and welcome to Let's Nourish Ourselves. My name is Dr. Bhavna Pathak, and I'm a hematologist-oncologist and the medical director of integrative oncology here at MemorialCare. I'm so delighted to bring this programming to you, which touches on the ways we can nourish our mind, body, and spirits with each other. And today I am delighted to introduce our wonderful dietitian, Mandy Trammell. Hello, Mandy.
Hi, I'm so grateful to be here. Thank you for allowing me to be part of this project and this conversation. It's really been a labor of love from lots of different contributing parties. Our dietitian and nutrition team here at Saddleback has collaborated with our counterparts at our sister facilities at Long Beach Memorial and Orange Coast Memorial to really try and come up with a comprehensive but really attainable message for our patients and families who are entrusting us with their cancer care.
Yes, thank you so much, Mandy, and to your entire team. Today's topic touches on that team spirit of oncology and taking care of patients with cancer, and the topic of nutrition around surgery. And this is especially important as patients go into a very intense period of their treatment where they're under anesthesia, undergoing surgery, needing to heal their wounds. So let's walk through that. Tell us about why we care about nutritional status before surgery.
Absolutely. So we can see in evidence and literature that patients who go into surgeries well-nourished have reduced risk of complication during the surgery and after the surgery. They have improved recovery. They have less likelihood of having delays in treatments or the next steps in their care. So really, there's no downside. When you're well nourished, you're gonna have better outcomes from surgery.
Wonderful. So just improved outcomes, decreased delays. So it's really worth the effort to focus on nutrition. Now, how long before surgery should we be thinking about nutrition, and what should we be focused on?
I love that you asked this question because I feel like so many people consider nutrition after surgery, but not necessarily before. So in somebody who's well nourished, we still want to be focusing on nutrition. So for somebody who's well nourished, about 5 to 7 days before your procedure, so about a week, you want to be making sure that you are getting well-balanced meals. And the number one thing we're going to be focusing on here is getting protein. So we want to make sure you're getting 3 meals a day, that every single one of those meals has a good source of protein. Can be an animal protein, can be a plant-based protein, can be a protein additive like a protein powder. All of those are fine, but we want to make sure we're getting it in 7 days before surgery. This can be especially important for our patients with GI cancer. There can be alterations in digestion and metabolism, and so they might need even a little bit extra to be able to meet their needs. Something else to consider is if you are not well nourished, if you fall kind of into that category of maybe being undernourished or malnourished, then we're probably going to want to focus on your nutrition for 2 weeks prior to this procedure. Part of that is kind of trying to rebuild some of those stores and get you ready for that procedure. So, but with the same principles, we're focusing on protein, we're focusing on getting adequate calories. One other area to kind of consider is if you have any kind of deficiencies. So most of the time we're going to get some kind of basic lab work before your procedure, kind of take a look at things. Talk to your provider about adding some basic nutrition markers to your lab work. So that could be like iron level. It could look like a thiamine or B12, which can be linked to anemias. Vitamin D levels. All of these are really simple to treat with supplements and with foods. And when you correct those deficiencies before surgery, you're going to have better outcomes on the end of it. So make sure to talk to your provider about correcting any kind of deficiencies you might have before surgery. And then you may also consider, especially our population of patients that are malnourished, adding a nutrition supplement drink. So this looks like a higher protein drink. It can be higher calorie if you need the extra calories, but doesn't necessarily need to be. And it's recommended that patients have 2 protein supplement drinks a day for the time that they're preparing for surgery. So that's either 1 week before if you're well nourished, or 2 weeks before if you are malnourished. And then have a conversation with your provider about the day of surgery. Depending on the timing of your surgery, the American anesthesia guidelines have been updated recently, where they really recommend not having to be NPO or nothing by mouth starting the night before. So unless you have a really early surgery planned, you should have some leeway to be able to have a light meal, some liquids in the morning, which most of our patients, they really just want, some coffee or some juice or some Jell-O. And it's safe to consume these items up to 4 hours before your procedure, according to the anesthesia guidelines. And so have a conversation with your provider, with your surgeon, about what their recommendations are, and how you can reduce the amount of time that you're fasting before your surgery. That's going to allow your blood sugar to be more stable going in, as well as your electrolytes and your hydration status. It also prevents unnecessary muscle breakdown. And so all of these are going to point to signs of better outcomes after your procedure.
Wow, that's wonderful. Thank you so much for sharing that. It's like really just preconditioning yourself for surgery to get the best outcomes, and whether that's 1 or 2 weeks before, or identifying the nutrient deficiencies and trying to get in more protein, to talking to your provider and being like, okay, what's my day of, the game day plan for my nutrition. Thank you for sharing that. So now, are the same principles applied after surgery, or are they different?
So very similar. We're still focusing on protein after surgery, and we're going to continue to focus on protein for about a week after surgery, so about 7 days post-operatively. We also, again, another good conversation to have with your provider is post-operatively, when can we resume your diet? Now, obviously with some surgeries that might involve the GI tract, that might be a little bit more tricky to navigate, but ideally the sooner we can start eating, the sooner we can wake up that gut, the sooner we can feed our gut microbiome. Those are all gonna help us control inflammation, improve healing. So we really wanna be able to eat as soon as it's safe to be able to do so. Again, we're going to continue the protein. So every meal, we want to make sure we have some source of protein. You can continue those 2 supplement drinks. If you're eating adequately and have a great appetite, you probably don't need the additional supplement drinks. But again, make sure you're getting plenty of protein. And then we're trying, your body just had this big operation or had some trauma, naturally, and it needed it, but there's going to be some inflammation. There's going to be some healing that needs to occur. So we're looking at foods that help support us in that. So things that are anti-inflammatory, things like omega-3 fatty acids and healthy fats like olive oil and avocado and walnuts. We're looking at colorful fruits and vegetables, which come with antioxidants that are naturally anti-inflammatory. And for some patients, that may look like having your fruits or vegetables cooked or soft while your digestion is still kind of getting back on track, and that's okay. They still provide benefit even if they're cooked or soft. And if your appetite is good, then we kind of want to stay away from, in this post-operative period, foods that are highly processed, foods that are high in sugars. Those types of foods create more inflammation in the body, and we're really trying to regulate that. As well as our blood sugar, especially if you're a diabetic or have issues with blood sugar control, we want to make sure that stays nice and even, because that is going to promote healing, especially in the skin. And then the other thing we tend to consider is hydration. So make sure that we're staying well hydrated post-operatively. The color of your urine tends to be a good indicator of your hydration status. So we don't want urine that is more apple juice color. We're leaning towards more lemonade, and if you notice it a little bit darker, be conscientious about getting some more hydration to kind of balance it out. The hydration is also going to help you keep your bowel movements regular. With anesthesia, with pain medication, both of those things can be triggers to slow down your digestion, can be increase your risk for constipation. So we really want that extra hydration to keep things moving nice and smooth. And really overall, this is just going to help you on your journey to recovery and help you towards that next step in your treatment.
Wonderful. Wow. What a nice thing to hear, that there are things you can do to help improve your post-op course, from just when to resume food, to sort of wake up your body, kind of like this journey you're going through, and you're really just waking your body up, very tenderly. Your gut, you're waking it up, and using foods that reduce inflammation, limit blood sugar spikes that can contribute to wound healing, and making sure you have hydration and like the signals of that, like looking at the color of your urine, and then as approved by your doctor, getting back into movement, which can also aid digestion. So anything else you want to add, or any last parting words for our Let's Nourish Ourselves audience here?
Yeah, I think this is a good opportunity to work with your providers and know that you're not alone. If you have questions or concerns, or you need some extra guidance, please make sure to reach out to a member of your cancer care team. We are here to support you, and we want you to be successful and well throughout this process. So
yeah,
make sure to reach out if you have any concerns.
Yeah, I really feel that in talking to you, Mandy. I know you sit on committees trying to advance this field, and I really just want to honor you for doing that. And I'll let you do the honors of sharing our slogan for this module.
Let's nourish ourselves.